All right, so this is the meeting of the January 12th, 2024 Board of Health for the town of Needham. First, I need to read a statement about this being a hybrid meeting according to Chapter 107 of the Acts of 2022 as an act relative to extending certain states of emergency accommodations as passed by the General Court and signed into law by Acting Governor Karen Polito on July 16, 2022. Revised Section 20 of Chapter 20 and the Acts of 2021. In so doing, provided modifications to the Massachusetts Open Meeting Law, which allow for flexibility to hold remote-only and hybrid meetings while preserving public access and, where appropriate, public participation. Currently, that additional flexibility will expire March 31, 2025, unless additional legislative action occurs. As part of today's hybrid meeting, all votes will occur via a roll call. So we'll open the meeting. So we now have a new policy, public comment period. So community members are encouraged to inform Needham Public Health Department by phone or email or in person by the end of the business day prior to the meeting of their intent to participate in the public comment period. The chair will first recognize those who have communicated in advance their desire to speak for up to 3 minutes. If time allows, others wishing to speak will be recognized in an order determined by the chair for up to 3 minutes. So I think we received 2 requests.
Yeah, we received 2 requests, and Lars was the first request, so he's here.
Great.
Concerning where you'd like for me to stand or be, or?
Yeah, if you don't mind giving him a seat, you want to pull a seat up or?
Would be most helpful for me to go to the empty corner there. I'm happy to do that.
He's over here.
Here, near the mic is always good. So people can hear. We'll quickly, thanks.
Thank you. Sorry, I feel bad.
No, it's a tight room. Thank you.
Thank you very much.
Okay.
My name is Lars Onyem. I'm a resident of Meadowbrook Road here in Needham. I'm a town meeting member from Precinct F. I'm also a member of the Quiet Zone Working Group, although I'm not here in that capacity. I'm also a volunteer for a citizen-led effort here in town called Safer Quieter Needham. We're advocating for establishing a quiet zone in town, which is related to the train horns. I live about a half a mile from 3 rail crossings in town. I have a wife and 2 young sons, so I care about safety quite a bit. My dad also lives at Chestnut Hollow across from BID, which is a 55 and over rental community. Just briefly, as of the 2020 census, there's over 32,000 Needham residents. An estimated 40% of 13,000 Needham residents live within a half mile of railroad crossings here in town. Under federal rules, the train horn or train is required to blast the horn 4 times, 2 long, 1 short, 1 long, at 96 to 110 decibels for at least 15 seconds as it approaches each crossing. Based on our current commuter rail schedule, that means 864 horn blasts every day. And since October of last year, when they ramped up their service schedule, which for all purposes, I think is a great thing, that means that the train horns are blasting from between 4:15 and 4:45 in the morning until 12:30 to 1 o'clock at night. And that doesn't count the overnight maintenance trains that run that aren't carrying people, but are doing other things. So at our best, our sleep window is down to a few hours a night. The group I'm a part of, Safer Quieter Needham, again, we're advocating for a quiet zone, which is allowed under these same federal rules. And with a quiet zone, the sounding of routine train horns is eliminated. All the other safety measures that we know and see today stay in place. The flashing lights, the gates, the bells on the train horn, the bells at the gates, those all stay in place. And then additional safety measures need to be added to each crossing to make that possible. So there's an acknowledgement getting rid of the horns is bad. So if you remove the horns, they need additional safety measures. Among many other factors related to this effort, we believe it's common sense, and we have found some research, although it's not, we're not medical scientists, that train horns have an impact on the health of Needham residents. Earlier this week, I submitted one paper from Dr. Todd Bentley from the Rail Industry Safety and Standards Board in Australia that discusses train horn issues around the world, the trade-offs, the cost, the health impacts in ways that different countries and areas are dealing with the issue. The World Health Organization also published a study called The Burden of Disease from Environmental Noise, which talks about how disturbed sleep patterns affect energy, health, mood, wellness, can lead to high blood pressure and cardiovascular disease. It also highlights the impairment of child cognitive development, which may have a lifelong effect on educational attainment and overall health. As I've been talking to fellow town meeting members, some have asked about whether the Needham's Board of Health has been asked to weigh in on the health aspects of this topic. We're expecting that a quiet zone warrant article will reach town meeting this coming spring. And so I'm here just to ask, and I have no idea about process or procedure, so please forgive me, but if there's some way to request, if the Board of Health could in some way look into this and provide some sort of a memo or letter or something that would be beneficial to those who are more concerned on the health aspects of this as they consider this potential investment by the town this coming spring. I did not come loaded for bear with lots of research. I have tons of it. I've been a geek on this issue for many years now, but and I'm happy to provide anything I can, but I just wanted to submit this request and happy to answer any questions or talk with anyone at any time.
So for Lars and as a reminder for the board, we instituted a public comment policy with sort of a 3-minute window, give or take. And the board generally does not respond directly.
That's fine.
But you've made the request, and if the board is interested, we could put it on February or March meeting agenda to have a longer discussion on the topic. And in that case, we would ask you or some other group members of the Quiet Zone Study group to come.
Sure, I'm happy to.
Okay.
And if there's any information I can help provide in advance of that, more than happy to. Thank you for
Okay.
giving me the few
Thank you.
minutes.
Thank you.
Thank you very much.
Can I just ask one quick question now?
Sure.
Is there any middle ground that you know of? So right now we have horns. The other option is quiet zones with other measures implemented. Is there like something else, like could be quiet from 11 PM to 7 AM, or is that just not?
It is, yes, you can establish what's called a partial quiet zone, which there is a limitation. I believe it's from 10 PM to 6 AM is what it's called for under the federal rules. It still requires all the exact same investment. It's just a matter of turning it on and off.
I see.
And so during the daytime, then all the additional safety measures that enable the horns to not be sounded in the middle of the night would still be operating, plus train horns. So, but that certainly is a possibility.
Okay.
From an implementation perspective.
Thank you.
Can I just ask a question? And this has been successful in other places, and I think of this as the feds and very hard to.
Yes, so there are, I'm sorry, I don't know the specific numbers, but I think 28 to 30 quiet zones elsewhere here in the Commonwealth.
Oh, okay.
And there are hundreds of them across the country.
Okay.
This quiet horn rule was established in 2005, and again, this is where I can get very nerdy, but
Okay.
there's a huge history behind this. And it has been around for a long time, and now we're about 15 years into its life, and so there's a lot of data now that the FRA has behind it.
Great. Okay, thank you.
Thank you
Lars,
for
I
your
can
time.
follow up with you after the meeting about
Please.
February.
Anything I can do to help. Thank you so much. Appreciate it.
Thank you.
Are there any other public, thanks. Is there any other public?
Any other requests for public comment?
Anyone online?
Doesn't look like anyone else is online, right?
I think, did I need to take a vote to open the meeting?
No. you
Okay, just the minutes. Okay, sorry, it's been a while.
It's okay.
Actually, just October, but it's still.
We have 2 sets of minutes this month.
Yes.
for review.
Okay, so we have the November minutes. Did anybody have any comments? Hi, Tejal, just recognizing that you're in the virtual room. Any comments on the meeting minutes from November?
I only had one comment that related to both of them, and that was to make sure that they were aligned in terms of the tobacco hearing. On the November one, it said it was voted that we would implement the sales restriction and the fine and waive the fine. Then the December one, it says we implemented the sales restriction and the fine, but didn't waive it.
Okay, I think we did waive the fine.
Okay.
So I just want to make sure that get added in that
Mhm.
it was waived. And so that would be in the December, just to amend into that.
Okay, so can we vote once to accept both, or do we have to do each? Okay, so we can vote to accept both sets of minutes. Tejal?
You gotta have a
Oh,
motion.
sorry, I
I'll
need a
make a
motion,
motion.
sorry. It's been
So
a while.
moved, so moved.
Second.
Second, okay, sorry, now vote. Tejal?
Approved, yes.
Okay, Rob?
Yes.
Ed?
Yes.
Kathleen, yes. All right, getting rusty. Okay, so first item on the agenda is the Regina Villa Associates.
Yes, so I'll do a quick introduction. As you know, we're working on the opioid funding process to do strategic planning, and they'll tell you what their portion of the whole process is, and it's been going great. And we have Matt Costas on and Keith Sonia, who are two of the team members that we've been working with. So Keith and Matt, I'll let you take it away.
All right, thanks, Tiffany. Yeah, good morning, folks. Happy to be with you this morning. Yeah, as Tiffany said, we've been brought on to help coordinate the sort of feedback and community engagement process on the opioid settlement fund project here in Needham. We're excited. We're kind of in the thick of it now. I know I've had a conversation with one of your Needham town colleagues, the deputy town manager, just earlier this week. I know my colleague Matt has something like 5 interviews today. So we're getting to know the town, getting to know a lot of the stakeholders, and getting some great early feedback. But next slide, we can just kind of go through, yeah, quick overview of the agenda. We'll just give you a brief background of how this project came into being, the workflow that we are utilizing to sort of yield data that'll help the town sort of determine how best to spend its abatement funds, the specifics of each phase. And then we wanted to kind of flip the table a little bit, flip the script, and make sure that we had something of an exchange here, and just sort of get your feedback as a board on gaps in coverage and approach. And then if there's time, we're happy to take any questions you all may have. So just for background, $525 million will be allocated to Massachusetts for opioid prevention, harm reduction, treatment, and recovery services following a nationwide settlement that the Attorney General signed on to, now Governor signed on to. 40% of that funding will be provided to Massachusetts cities and towns. The town of Needham will receive a total of a bit over $1.8 million through disbursements into the 2030s, with the last due in 2038. To date, $217,000 has been dispersed to the town. These funds will allow the town to engage with and strategize on issues, gaps, and services related to prevention, harm reduction, treatment, and recovery. The Commonwealth did determine abatement terms. Fund projects should be consistent with allowable spending categories, and those categories are opioid use disorder treatment, supporting people in treatment and recovery, connections to care, harm reduction, addressing the needs of criminal justice involved persons, supporting pregnant or parenting women and their families with neonatal abstinence syndrome, preventing the misuse of opioids, and implementing prevention education. Projects should also incorporate community feedback, which is certainly why RVA is on this project. They should also address service disparities to increase access and equity in treatment. We should be leveraging existing state, city, town, and community opiate use disorder, mental health disorder, and behavioral health disorder programming and services. So getting to know some of your colleagues and some folks in the field to sort of identify what already exists and what gaps there are that could potentially be filled. So that's a bit of the background. Here's our workflow. So we're kind of right in the thick of step 1 here with stakeholder group interviews. Folks we have scheduled to be interviewed, or who we've already interviewed, include, like I say, colleagues from the town, including the town manager and deputy town manager, folks from Needham Public Schools, folks from Beth Israel Deaconess Medical Center, folks from the Becca Schmill Foundation, folks from Sober in the Suburbs. So a lot of, a good cross section of practitioners and folks working in town government who are offering thus far sort of differing perspectives and yeah, kind of helping us to identify some gaps and where the town might go. We will then pivot into small group meetings. So these are intended to include folks who are sort of more directly impacted by opiate misuse. So folks who are in recovery, family members of those who have suffered through opiate misuse disorder. Again, trying to figure out what gaps those folks experience to care, prevention, harm reduction, etc. We'll then pivot to a large community forum where we'll hold this at an accessible location with language services if need be, in an effort to sort of again yield a more universal opinion from the community at large, and from there we'll sort of distill all the data that we gather and author a final report that'll again be accessible, and we'll also include a summary that your colleagues can use while sort of determining next steps. But we're excited about this process, and as I say, we're just in the thick of it. So step one, next slide, is the stakeholder group interviews. This is already slightly out of date. We are, at the time, we had 7 interviews scheduled. We're now up to, I believe, 12, Matt. So it's actually a bit more than we thought we'd end up on the calendar, but it shows the I think enthusiasm that folks have to engage in these discussions and to lend their expertise to the process. And I think ultimately will that'll be very beneficial to the town as it's sort of determining how best to spend its settlement funding. So we're right in the thick of that. Then again, the small group meetings that I mentioned. This is technically one of these that we initially scoped, this meeting here that we're all on, and that's why we include that question on gaps in the agenda. But from there, we want to have conversations with the town select board and the FinCom. But then, as I mentioned, family and loved ones of substance addicted persons. We're working with the town, but also some of the folks that we interview in that first stage to help identify these folks. And then again, persons living in recovery, once again, working with stakeholders that we're engaging with to sort of build out a roster of folks that might be interested in discussing their experiences. Again, large community forum, accessible presentation. Mechanisms to feedback include virtual options for those unable to attend the forum. RVA has a long history of sort of finding ways to ensure that folks are able to participate if they're not able to join in person. So we'll work on utilizing existing town resources to make sure that folks have a channel in which they can sort of provide their feedback. We'll again, author a summary of the event highlighted by key insights, and work with the town again to, maybe broadcast that on your local cable access channel, for example, just to make sure that folks are able to take it in and to, again, have channels to weigh in. And then finally, the final report. This will include any qualitative and quantitative data that we receive through those initial 3 steps. The report should outline Needham's challenges and substance misuse around substance misuse, and will present a streamlined summary of recommendations yielded during that engagement process. That'll include a final report, an executive summary translated into relevant languages, which we've identified as Mandarin, Russian, and Spanish. And then a slide deck as well that again, you and your colleagues can refer back to. So that timeline, so as I mentioned, we're kind of in the thick of it with the interviews. Next month, we expect to schedule in those roundtable discussions. We expect the community forum in the spring in April, and the final report due in June. So that's kind of the timeline we're working on. I hope that provided you a bit of background as to what we're up to. But again, I wanted to sort of use this time, Matt and I wanted to use this time to, again, turn the tables and, whether it's in harm reduction, prevention, gaps in services, etc. We wanted to, ask you folks, get a few bullet points back that we can incorporate into the final product. What gaps in coverage and in approaches, as members of the Board of Health, do you folks identify as being potentially an issue with the town at this point? And I'm not sure, Tiffany, if we want to kick it to any one person, but yeah, I think folks should feel free to weigh in. And I know Matt
I'll
is.
scroll back up to the 6 areas, and maybe
Yes.
that'll help if there's any thoughts on
Exactly.
what you think we should be doing more of in regards to the opioid.
Well, I can just throw out one thing, as I was reading this. I know we're at the very beginning of this, but this is a long-term funding effort going through 2038. And I think we all hope that we'll be in a much better place in terms of opioid use and misuse in 2038 than we are now. So I just want to make sure that this, that you were able to somehow incorporate in this, looking towards the future, and, are there mechanisms for reassessment and redirection of the funds as necessary?
Yeah.
Is this going to be done as a 15-year plan, or is it going to be done as like 3 5-year plans with
So it'll be
reassessment?
a 5-year plan. So Regina Villa is doing the community piece, and then we have EDC that will come on and take the data from what they've collected and help us create a strategic plan. That will be a 5-year plan with an evaluation piece in it, so we can evaluate yearly whether or not these are the right processes. At that point, after 5 years or close to those 5 years, we may have to reevaluate whether we do it again to see what has come of it.
Tiffany, maybe you can remind the board the spending that's already sort of
Yeah.
targeted or in process.
Yeah, so currently we were able to get approved at town meeting spending for peer recovery coach. So Angie McDonald has started that process as of the 2nd of January. So she is currently meeting with groups in town, other key stakeholders that may have people they want to refer to her, and she's teaching them the process about how this will work. So that's in place. And then we got the naloxone boxes, or the sandboxes as we call them, because we'll put the naloxone in them. We got approval to use 3,000 for that, of that money to buy those. So that gives us about 11, plus we're getting 4 from the DA's office. So we'll have 15 sandboxes that we will place around town. Right now, just piloting town AED areas. And then based off of what Regina Villa finds, we may request more, if that's one of the things, for around town, for residential places and things like that. So we're working on that process. Ginny and Kelly are working on the process of figuring out which areas are best for town buildings to place those 15, because we have 19 AEDs.
And I'm assuming there's a communication plan as well that'll go with that, so people are aware that these exist now.
The naloxone boxes?
Yeah.
Yeah.
And Tiffany, you mentioned the evaluation plan. So I guess just going a little deeper, will that'll be specific metrics for specific interventions to try to really determine effectiveness? Is that when you describe evaluation plan, is that what you mean?
Yeah, so once Regina Villa works with the community to determine what the best outcome or thoughts are based off of the data that we produce, yes, that is the goal for EDC, is to help us kick off an evaluation plan specific to those recommendations, so that if they get approved through town meeting, then we can utilize those to adjust those recommendations or redo the needs and do new communication, or not communication, a new connection with the town to see if something's changed or what's different. So yeah, it'll be specific, or at least that is the goal, to make it specific.
Yeah, we'd love any feedback folks have, maybe in their day-to-day roles, again, about sort of these the spending categories that the community, that the Commonwealth identified. So again, harm reduction, connections to care, supporting folks in treatment and recovery, any of these types of things where, you know, maybe you've been confronted with the fact that the town does not have a certain amount of resources available to connect folks to these services. Any thoughts on prioritization, for example, as well? Which of these categories maybe would you identify as perhaps the most important for the town at this point?
So I think the board has heard me say it before, but we have through our drug-free community grant, through the town funding for the Substance Prevention Alliance of Needham, to some extent through our STOP grant, we have funding that's focused on prevention and more specifically youth prevention most of the time. We haven't historically had funding for harm reduction or treatment or recovery. So to me, those are some of the more interesting aspects of this money is, can we sort of expand our work into areas that previously, because a lot of it was grant funded, we weren't allowed to work in. And I think that, at least to me, that's one of the more interesting outcomes potentially, is to think about the treatment and recovery, the connections to care, that sort of thing. Harm reduction.
Right.
Connections to care, but not care per se, right? I don't-
Well, so opioid use disorder treatments, that would be
Okay.
care, I guess, in this
Okay.
context.
Mhm.
I think there's a lot of questions about what that would look like. Is that helping facilitate a connection to a treatment center? Is that, you know, helping with the logistics of a ride to a treatment center?
Mhm.
Is it potentially a partial scholarship or a stipend if you are going into treatment and are a Needham resident?
Mhm.
I don't know.
Mhm.
You know, a residential treatment program is a substantial time commitment and also financial commitment.
Right.
So I don't think our money would go too far if we were paying for the full cost of treatment, but
Mhm.
we can potentially make it easier for people to access.
To get there. And when harm reduction, what do you mean by that?
Well,
Narcan is an
Narcan.
example of harm reduction,
Okay,
yeah.
right.
Safe ejection sites are examples of harm reduction.
Mhm.
Yeah.
Fentanyl testing kits, for
Fentanyl
example.
test strips, yeah.
Excuse me.
So so when we're interviewing folks, we do sort of ID some potential. So for harm reduction, for example, Narcan training, overdose prevention, emergency medical services programming, fentanyl testing, as I mentioned, connections to care. And then for treatment, we do mention, you know, transportation vouchers, housing for those living in recovery treatment, childcare services for parents while they attend treatment, job placement services, the recovery coach, family support groups for those impacted by a friend or relative experiencing opioid misuse, and increased peer recovery efforts. So again, support groups for those directly affected by opiate misuse. Access to computers, things like that. Some things that you might not immediately sort of identify as being related to this issue, but nevertheless has a trickle down or knock on effect to how folks approach their recovery. So again, I think, you know, what we're doing is having these conversations, having folks sort of offer initial feedback and, you know, sort of prioritization rankings. And I think from there, already, I think we're starting to see some gaps emerge as far as what folks in the town or in the field are sort of familiar with, or, you know, I would have thought to maybe allocate funding for. But again, I don't know if beyond Tim, Tiffany, if you folks have had any thoughts like this, if you've, you know, I mean, again, I feel like we're all sort of we all know somebody or a family member who knows somebody, that sort of thing. We're only a couple degrees away, I think, typically. So I don't know if there's something you've identified either through your work or in your personal life where you know, you sort of wish certain resources were available, that sort of thing. We're happy to take that as a data point from this meeting, if so.
Yeah, I'm wondering, and maybe it was somewhere and I missed it. But you know, for me, it would be helpful because Tim, you have this knowledge, and Tiffany and others, of kind of, well, what are the existing things that we have in these 6 buckets? Because you mentioned we, you know, do a lot with, for example, the substance abuse prevention piece, but maybe not with treatment or whatever. I don't know if there's like a high level summary of that, of your perspective around gaps, but that would be helpful for me at least. And I don't know if others feel like they've seen that, or maybe I missed it.
No, yeah, it's a fair question. So most of it is prevention and most of it is youth prevention, to be honest. So the main things we have for harm reduction is Narcan training done by a lot of the staff members within the health division, and we're working on the connections to care that will be rolled out with the peer recovery coach. Those are about it, to be honest.
Okay, that's helpful. Thank you.
Yeah.
But especially in the context of like a community forum, maybe we should try to produce a one-page summary or an infographic that we could think about, handing out.
Yeah, we anticipate there being some additional collateral for folks that are sort of coming in to attend, or and then that would also be posted on the website. That would help sort of make these high level observations more readily available for participants, for sure. Okay, is there any other sort of questions about the process or about our work that folks have?
No, I don't think so. Thank you.
Great. Well, again, we appreciate the time and look forward to remaining engaged with you folks over the life of the project, and hopefully yielding a substantive report that you folks can then work with.
Thank you, Keith. Thanks, Matt.
Thank you.
Thank you, everyone.
Okay. Next item is you, Tiffany, again.
Yes.
Strategic plan.
Forgive me in advance if this does not take 20 minutes, because I was not planning on it taking 20 minutes, but did you guys have any questions?
Yeah, we read it very
About the
carefully. Mhm.
So yeah, basically, because we discussed it when, I think like October or something. And it is pretty much just a little bit more detailed on what we did to get to the point, so our processes. And then we put board approval on here on February 9th, because that was the original plan. But we moved it up because we didn't have a lot to talk about today, so we'll change that. But otherwise, the goals themselves and the information that we got from Tejal and Kathleen when you guys spoke with BME was integrated into their, especially into the goals and the deliverables. So yeah, any questions on the plan itself? If not, I'll give you a little bit more detail on next steps. Yeah.
No questions on
And I have
the
questions.
plan.
Yeah, no,
Yeah. So next steps with that is we're continuing to work with BME, and this will be kind of coordinated with our community health assessment and our community health improvement plan, and the deliverables and the goals that come from the community health improvement plan. So we'll be working with BME and the accreditation steering committee, and I don't know if we've met Allison. I just don't think she's in here. Allison Bodenheimer is our new accreditation support, so she's helping Lynn, and she will really head the performance management piece. So she's taking on with sorry, I keep looking at Virginia, with BME a process of tracking the goals and the one-year deliverables, of reviewing those, whether or not we're going to use a system or whether we're just going to use like an Excel spreadsheet, and then when the 1 year is up, grading that for year 2 and year 3. And we're doing that in coordination with the CHIP, because a lot of things match between our community health improvement plan and the strategic goals we've got set. This was done a little backwards. We did the strategic plan before we did the CHIP. Our next go around, which will be before we have to reapply for accreditation in 5 years, we'll hope to do a community health assessment and a CHIP before we do a strategic plan. That way we can build that way instead of the way we did it this time. But yeah, so that's the next step. Any questions?
Sorry, what's the community health, what does that entail, a community health assessment?
Sure, so the community health assessment, and Julie did 95% of it, is to, we took a lot of the data from the community health needs assessment from BID.
Mhm.
And then, like our senior survey that we've done and the housing survey that we did in the last few years, and kind of put together what for public health Needham kind of looks like. And then we took BID's priority areas and cut them down a little bit more specific to public health
Mhm.
and what we can work on.
Mhm.
And that is almost finalized, yay for us. So it took us several months. And then we'll present that, I guess, probably next month.
And that was something we talked about last, like in the future, do we do our own?
Yeah, we'll need to
survey
get
or
some money to
something?
actually do, yeah,
Right.
yeah, and that would be the preference, is to do our own, because we're missing, large gap of 19 to 60-year-olds
Right,
in that piece. So,
great. Any other questions or,
Oh, no,
okay, great.
no questions.
And I was just gonna say, I really did like the alignment between kind of the Board of Health goals and the department goals. I thought that was great. And I know a ton of work went into this, so thank you to everyone.
thank you.
Great. All right, I guess budget. Yeah, Tim.
So the annual report is included. There's not a ton for me to add to it. It does take work by the staff to develop and compile it. I don't know how many people read through the town's annual report, but there is valuable information in there. And so I appreciate the staff working hard to do good write-ups and to include some nice graphics. I think it always strikes me that it's much easier to find a nice graphic for the senior center or the youth and family services than it is for public health, which is a good reminder of the work we do. We don't have a ton, I don't have a ton to add unless the board has questions.
I mean, it's a very impressive report, and it just shows how robust public health is in Needham, which I think is fantastic. One question I had is, it says there are 5 units in the public health division, and then you have a whole section on epidemiology as a unit. And I wondered if we should include that as the 60 units. Because we certainly, we look at a lot of data every month that I think epidemiology collects, and we rely and make decisions based on that information. So, and I think it kind of adds the importance of epidemiology and what we do, and for just future funding for positions and things like that. I think I would recommend adding it as a unit and saying that it is.
Do you remember when I did the org chart, did I actually adhere to this or no? Did I add something?
So the org chart
At the same.
doesn't show units.
Okay,
It shows
just staff, okay,
spread. So
Okay.
yeah, not really units.
okay. But maybe we can consider that. That's
Thought.
Yeah, and unless the board has other questions, we can jump into the staff reports.
Yeah, no, that's good. Okay, anything else? Okay, so we can jump into, I guess it's accreditation first. Yeah, yeah.
So they're just being pulled over.
Morning, everyone. I actually don't have much to add to what's written here in the report that I sent you. We're most excited about having Allison Bodenheimer join us to work with all of us on accreditation. She is not able to be here today. She's out sick, but I hope that you'll get a chance to meet her next month. The biggest news, just to follow up on our last meeting, is we had submitted our application to FAB, to the Public Health Accreditation Board, just before the last board meeting. It was accepted, and now we are deep in it.
So no takebacks.
I will start uploading documents to the Public Health Accreditation Board electronic, I don't know, file, whatever it is. I'll start doing that hopefully by the end of February. I am excited and optimistic and daunted. That's really all I have to say for accreditation, unless any of you have any questions.
It's great.
Well, I know it's an incredibly complicated process, and I think you've done a terrific job.
Thanks.
Yeah. Great job. I know getting that in and now chipping away at the rest of it will be.
I do have to say that many staff members are contributing to this process as, I mean, it's absolutely necessary, and are shouldering quite a lot on top of their regular jobs, and I appreciate that.
And this seems like the kind of thing that could constantly get pushed to the side to put out fires. I know as a consultant, the long-term stuff gets pushed aside, so staying on top of that is really important. So thank you.
I do want to say one thing, and that is that I am already thinking about long-term plans for how we maintain accreditation. Have been compiling. I've started actually putting together a document, which I will update as I go along, as we come to understand what will be involved in maintaining this. And we'll share that with you all at some point this year, I think.
That'd be great.
That'd be a great resource. Thank you. Okay, shared services. Thanks.
I've asked her multiple times, so it might just be you, Sam.
Okay, that was
Yeah.
the plan. She was
Okay.
gonna be on till 10. Carrie's actually teaching a course at VU this week for emergency preparedness, so she apologizes for not being able to speak today. The first topic we just wanted to cover was we finally hired our new regional trainer for the field training hub. So this is Rebecca Queenie. She just started this week and we're really excited to have her on the team. And just to recap, our field training hub is called the North Central and Metro West Field Training Hub, and it comprises 29 communities divided into 5 shared services groups. So the Charles River Health District is one of those 5 groups. The field trainers, we're currently being trained and certified by the Massachusetts Public Health Central trainers at the state. And once we are certified, we will start taking mostly inspectors into the field in small groups to conduct the field training courses. The field training portion of the courses they'll be taking at the state level. And the trainees are largely members of the current public health workforce, just to say, not necessarily just new inspectors on the job, but will be sort of training and retraining, hopefully a lot of the public health inspectors currently operating in the district. The Charles River Health District communities have begun legal review of the intermunicipal agreement. The agreement has been drafted by the experts at the municipal attorneys at the MAHB, which is the Massachusetts Association.
Health. It's okay.
Thank you.
We know an
I'm trying
acronym,
to
but
spell
someone
it
else
out.
doesn't.
Thank you so much. So that's going around now, and I think we've made some really great progress on that. So that's really exciting. Our regional inspector, Thalia, is now going to start conducting inspections in Dover, which I think is a lot of progress. We just got the list, so she'll start on that soon. And all the food inspectors for the Charles River Health District communities will be attending trainings in January and February by Relevant Services, which implements Food Code Pro and the other inspectional programs. So now that everyone in our district should be up and running in that, people will start attending those trainings hopefully in the coming months.
How
those
does
were-
that work with our software that we use? Like, will they have the same they have the same software? right?
Yeah,
Okay.
so the entire shared services unit signed contracts with Relevant now,
Okay.
implemented by shared
Oh,
services.
relevant is the.
So everyone, not everyone will use every system, i.e. they have capabilities to do housing inspections, camps, sort of all the environmental health related inspections. Not everyone signed up for every single
Okay. right.
application, I think depending on what their needs were, but everyone at minimum will be using Food Co Pro now.
Okay.
Mhm.
Standardization, I love it.
Mm-hmm.
Great.
One of the great things about the Safe Act, Denise.
Yes.
Any questions? Traveling meals? They're here,
Yeah,
they're
nothing
here.
enough.
Yeah, I mean.
We did add the hour bars up to the
I
chart.
love it.
you
Yeah,
can see,
the 5-year
Martha,
average.
which
Look
was-
at the numbers over the 5 years.
I know.
That's big.
It does
jump.
bring it into perspective when you see
Yeah.
it.
That's, I mean, food got incredibly expensive, but that's, that average is going up.
Well, I think also it shows you the changing demographic in Needham
Mhm.
as more people. They tend to stay in town, stay in their houses, and then eventually they get to the point where
Mhm.
they need this.
It's expensive.
Mhm.
Mhm.
Definitely.
And the, one of the reasons, one of the benefits of this is you have contact with the
Right.
people. And it shows
Yeah.
right here under the 911 calls initiated.
Yeah, I mean, that's huge. That was really a good help that we had a driver check in because we didn't know.
Yeah. Yeah, just a face. I mean, it's small numbers, but still, yeah, somebody seeing another person. Some of these people never see anybody.
Mhm.
And, oh.
I had a question about, there was one person that was found on the floor and sent to the hospital. Do we have any support for the person who may have found that person? Because it's kind of traumatic when you are in that situation. So I'm just curious how we support our folks that are delivering meals if they end up in this situation.
So Rebecca does check in with the driver on that piece, and we do offer support if needed and things, so we take it on a case by case, but yes, that does get part of our situation. We just want to make sure that the driver is okay, and so we do check in on them.
Good point. Any other questions? Okay, public health nursing.
Yeah, so we finally gave out all of our purchased COVID vaccines, but we still have vaccines available for uninsured, and 18 and under. DVAC had two resource tables, or discussions, I should say, one at CAF with Brett Garlick, and then one at North Hill that was very well received. And yeah, if he has any questions, I don't have much else to add to that.
Question on malaria.
Mhm.
Was that somebody who went to that somewhere and came back in malaria?
So the case is under 5, can't give specifics, but the travel was involved in what was there, and they are taken care of.
I would assume so.
Yeah.
As Ginny mentioned, and I think as we've talked about with the board, the guidance from the state Bureau of Infectious Disease and Laboratory Sciences is that if you're a community of under 50,000, which Needham is, and there are fewer than 5 cases, it could be identifying to sort of say there's only one person. So they suggest saying fewer than 5. You can tell where there are no cases because it doesn't say fewer than 5, it's just 0. I think and I think it's challenging sometimes and frustrating, especially maybe from Steve's perspective, Tejal and Rob as physicians, to want to get more information about it. I think when we're trying to protect the patient's privacy and confidentiality, I think you should know that we will come to you if we need resources or support, or if we need to advocate for something. And you can always ask us sort of those questions, like, is this situation under control? Do you need, additional funding, additional staff time? So I think it's a little bit different than how we've treated it in the past. So I think it's appropriate, but I know it could be a little bit frustrating. That's why we just want to highlight it.
And the latent TB, like, we've been seeing that for a while. I know there's often some in the community, and is that, now we're up to 7? Is that like a trend, anything? Is it immigrant? I don't know, like where, how does that get on our?
Yeah, so I think that with more people immigrating here, we're
Yeah.
getting more ATVs because they can need to get assessed before they come here and then they get
Okay.
assessed when they get here.
Oh, okay,
So
Mhm.
even if it's active early, I get notified and then I go from there.
right.
I will add with malaria, there has recently been some transmission in the United States for the first time in decades. So it may not, may not necessarily involve foreign travel. That's kind of what we always think about, but we may see some increases there.
It was in the paper, right? Okay. Everything else I assume is kind of small numbers and nothing concerned about. Any other questions on that? We can go to Epi.
I think maybe the only other thing I'd highlight, and it's something that Tiffany and then nurses and I have been thinking about, but there have been more people, or maybe even fewer people seeking. 2023 had, way more people seeking gift of warm fuel assistance than in the past. But it's not just the number of people, it's the bill and the payment that's necessary to make sure that there isn't a utility shut off. That has gone up. I guess I remember thinking a few years ago it was like a $200 bill or maybe a $300 to make sure utilities weren't shut off, and now it's like $700 or more. So it's just something for us to be aware of. I think one of my goals for this year is to figure out how to sort of reinvigorate the Friends of the Needham Elderly, who support the Center of the Heights, and the Friends of the Needham Board of Health and Traveling Meals, who support the Public Health Division, to try to have people sort of advocating for additional resources. Just because we are responding to a need, and there's been a lot of it, but we have not nearly been taking in as much money as has been going out.
Now epidemiology.
Just a few sort of notes on COVID cases. So, I continue to put the number of confirmed COVID cases that we have, but as you can see, we had an increase from November to December, but it doesn't really at all compare to last December, and that's really just a reflection of the change in culture around COVID. Far fewer people are going out and seeking medical care and getting an official diagnosis, so we're only getting those notifications when we get a confirmed case, someone has sought out medical care and been tested. I think anecdotally, we can all say we know a lot of people who are sick right now, and we all know someone who has COVID. You may have seen in the news that the levels of the virus in the greater Boston's wastewater are at the highest they've been since Omicron. They are not close to where they were when we hit that Omicron peak in January of 22. But they are, it is pretty high. And I think one notable thing from that is that the hospitalizations are not as high as they were during that Omicron peak. They're still significantly below that, which is great. But I think it's definitely a trend to keep an eye on, because again, we're not getting notifications of these cases. So the wastewater is really the data that we have to go on. A quick note on the vaccination data. I don't like the way the state is presenting this with these ranges for each age category. I don't think this is helpful for us. So I guess I'm just looking at the total vaccinated at the bottom of the table and seeing that we have about, a little over 50% vaccinated for the flu and just about 34% vaccinated with since the beginning of this COVID season. So you can see that interest in the booster has really definitely declined, despite the fact that we have given out all of our COVID boosters and flu shots. So that is something interesting to note. I just wanted to add in a couple notes about the biosafety committee. So we met in December and reviewed 3 biosafety permit applications. The meetings are going really well. We are still fixing the process, and I'm sure we'll continue to fix the process every time we have a meeting. But it's been really successful. The applicants that we're working with are really friendly, and it's been a really pleasant process, despite the fact that we know the regulation does require a lot of things from these companies. Sai and I are starting to investigate inspections of the labs, but we don't want to do that until the labs are up and running, because we're not really inspecting their process if they haven't started their work. So we're getting in touch with other municipalities that have biosafety or RDNA ordinances to try to see what their process is, come up with a checklist to go into with this. So hopefully we'll have updates on that in the coming months. But it's been a really successful process, and the biosafety committee is it's been a really great experience so far. That's it for me.
It went very well. And there's gonna be some little wrinkles here and there, as you said, and we just have to iron them out as we go along. And I'm very impressed with the other members of the committee.
All right, so I can start off first. So like last month, a lot of my time went into kind of working through the permit renewals, which included all like the food establishment permits that had to get renewed for 2024, the body work permits, sharps. It's just, yeah, all the waste hauler permits. So involving grease and septage, not really the trash yet, and the hotel permits. So it's just laundry list of different permits I had to go through and the inspections that were associated with them. Got through that and just working through the stragglers right now. And so that was that. Any questions about that I could answer. But you can see like this month on our, I guess our numbers of permits issued, it's been a jump. So in this past month, the other thing I wanted to talk about was Rice Barn. I followed up with Charles this past week, and he's kind of was unresponsive for the past month. And then last week, mentioned that he's still looking for a plumber and still trying to work through that. Just getting high bids and not really committing to a plumber. And also spoke with the landlord this week as well, related to that. Outside of that, just a lot of my time went into the permit renewal process, plus like working the biosafety items. One thing I wanted to highlight was the Christmas Xmas, or the Christmas dinner at Temple Beth Shalom. That was a really great event. I feel like it's been ongoing for the last like 40 years. I was able to do the inspection for that, and that really supplements the Traveling Meals program, because they don't really offer that program on Christmas Day. So they're able to provide meals to the elderly during that day. So
How many people were in attendance, do you know?
I think there were served like 140 meals, I think, something like that, yeah.
We're sort of seeing the like, housing cases tick up again, right?
I was just gonna give a quick blurb on those. So, yeah, it's been busier. I mean, I keep saying, well, these are rare, but they come up here and there, but we have been getting calls from fire a little bit more frequently than usual. So we're hitting those head on as we get them. We put our group together, our hoarding task force group, if it involves that type of situation. Or we have our, social workers in Springwater go to for some of these residents to make sure they have the help and resources. And it's been, we've been going through each one and trying to work with the owners and helping them and to get through this. So, but they've been tricky.
We saw like a spike after COVID, right? Because we were sort of shut in and.
So, and then just the other quick updates I was going to share was that I'm been in touch with the state massage inspector. Again, we're going to try to set up some spot check unannounced inspections of our body work establishments. I know that's kind of been a way we didn't do them last year or the year before, but we're getting back on track to working with that inspector. Same inspector is there. I was happy to see. So he was looking forward to working with us again with the Needham Police and doing our unannounced inspection. So we'll try setting those up next month. That's our goal for those. And we're also looking to set up another tobacco check too, as well. So,
We have the birdseed bandit. Have we figured that one out? Still going on.
Still ongoing. The snow helped, so like it covers the difference.
We're trying.
And that's still ongoing.
I believe it's still ongoing, yeah.
Okay, yeah,
Trying to track that down.
yeah.
And, you know, as a side note, we're also experiencing some issues at the Chapel Street shared dumpster area. We've been, we're gonna be setting up a meeting with the landlords and the property maintenance people out at that location too, and have the people that share that dumpster area, you know, in that meeting, and so that we can kind of have a plan going forward to be, you know, more strict, because they're looking for outdoor seating approvals
Right.
in that area, and so we're kind of piggybacking on that with Miles as far as like,
Yeah.
okay, these needs to be incentive now, we gotta keep this area clean.
Right.
It doesn't help the bird seeds across the way, you know, we just have to
Right.
make sure everything is
Yeah.
clean and maintained.
Yeah, and with the tracks, and there's just always gonna be harborage, so, you know, like having
So-
food source on top of it, it's a big problem. Okay, great, thanks. I know you guys do a lot of heavy lifting. Okay. And now, substance use. Carol.
Nice to see everyone.
Sorry, Lydia, yeah.
And Lydia's there and she'll give our update, but I just wanted to say an important part of the work that our four towns, we meet monthly. The two health directors asked us for more information on the behavioral health helpline and the CBHCs that were started last January. So it's a year. And I know that you're all familiar with that, but many of us can't sustain the contract with William James Interface. And they also, for a few reasons, have capacity problems. So the behavioral health hotline, we invited the regional representative to speak at our last meeting. And I just feel like all of us as residents, whatever town we're in or whatever volunteer job we have or professional job, should remember that the state has this triage hotline 24/7 to support residents of all ages for acute care, crisis, mobilization, and just peer recovery treatment. It's a conduit to the second part of the program, which is the community behavioral health centers that are open, staff 24 hours a day, but their real main working hours are 8 to 8 every day and 9 to 5 on weekends. So I try to remember in my town, we don't have the capacity that Needham has in our other towns that we work with Mass Call, don't either. So I hope we can all remember that there's 2 tiers and 24-hour support through the phone, and then through walk-in through the CBHCs. Our catchment area is 190 Lenox Street. And we are trying to maintain relationships with them so that when our towns ask us for help, we can remind them that there are programs, like we say, for acute incidents and trauma and loss. And so the more we use these new state resources, the more they're keeping track of data and calls, they'll be continued to fund. But it's a huge, almost $1 billion few-year investment. And we're also, and I'll make sure I congratulate Lydia, but this is about workforce development. Working with Rep. Garlick and other legislators, they understand that we have to build the workforce for social work, clinical support, even nursing. So that's part of the money the state has allocated to this whole behavioral health initiative, which was launched last January. So the behavioral health helpline 24/7 for talk, support, triage, and then the walk-in CBHCs. Ours is Norwood most closely. And I know I've shared all this. There's also one in Waltham and Milford. And people aren't alone is what I want to say. There's so much stress. And I hope we can all remind people that there's supports 24 hours a day locally in Massachusetts. And then I'll give this over to Lydia, but I'm proud of her. It's her 1-year anniversary with us due to the fact BSAS doubled our grant. And I'm proud of the work she's done, and I'm grateful. And she'll be going to Washington and going to the CADCA National Forum at the end of the month, which is about 3,000 people from around the country that SAMHSA and ONDCP and NIDA put together. So hopefully that'll be empowering and related to workforce development, because we need more young people in the field of prevention. So if anyone ever wants any information about these behavioral health resources, the programs the state has put together, and I will also say this, most of us attend the Needham CCIT meetings that Chris Baker does quarterly as community partners. And I want you all to know, as Board of Health, Tiffany attends, Ginny, the nurses, Karen, these quarterly meetings have the hospitals, Walker School, Riverside Emergency. And what I've seen in this past year is, since the town committed to having the emergency services social worker full-time working in the Needham Police Department, the connection with the town services has really been enhanced. Her name's Emily Turnbull. She's amazing. And she also, when we talk about the behavioral health supports the state has put together, she's referring people to those. So nobody in Needham has to feel they're alone. And again, Tim certainly put together a huge bench, but having the stakeholder meetings quarterly with everyone, and then of course the monthly core team meetings. So Needham's in a good place, and we just need to remind our neighbors and friends that the resources are there now from the state. So I'll let Lydia give our update, and thanks for letting me talk.
Thanks, Carol. I'll try to keep it pretty brief, but as a reminder about our funding, Carol mentioned that our funding was doubled. Before I started, it was 125,000 per year, and then it was doubled to 250,000. In FY23, we received funding through fiscal year 2025, so we had 250,000 approved for both of those years. We made our budgets for both years in FY23, so we spent a lot of time this past month with our contract manager for our grant, adjusting, doing a line item amendment to our budget, aligned with our strategies in our strategic plan that we mentioned was submitted at our last month's Board of Health meeting. We expect that that will be approved and kind of shared back with us by next month, February 1st, so we'll be able to share our final strategies. Carol also asked that I bring and share the opioid settlements fund guide or toolkit that we had shared a few months ago, just because of the relevancy now, as Tiffany was sharing more about what Needham's planning to do. We wanted to share it with the board kind of for any feedback or comments you might have, and just kind of like as a reminder that it's on our town website. We've been sharing it, thank you, with our other Mass Calvary communities as well. And it was created with the Academic Public Health Corps. I'm not sure if I mentioned that, but we, as prevention staff in Needham and the other towns, we were receiving a lot of questions that we didn't always have answers to, or like time or capacity to provide. So we hoped that this would be helpful, and it's still a resource to share with people who have questions about the funds, like the schedule for them, the amounts for each town, how they can be used, reporting requirements, technical assistance. And Carol and I have been attending the technical assistance office hours too, just to kind of keep updated. And lastly, the other main thing we're working on is, as we move towards implementing strategies for our strategic plan, building capacity in our lower capacity towns, which is part of our grant mission. Specifically, those are Walpole and Westwood, because they don't have prevention staff. Although, as of last month, really this month, Dedham's drug-free community coordinator has resigned, and their public health nurse resigned too. So they're currently filling those positions. But we're excited about the strategic plan implementation and optimistic. We look forward to sharing that soon.
Very good.
Thank you.
Thank you.
So I'll just say, if you look through that toolkit. Again, we worked with APHC on that, and Tim and Tiffany reviewed it, and now we have control of it and can edit it. It's on our town website. It's such a cumbersome program to think about, so we broke it down, of course, for our 4-town region and what monies are there and what the schedule is. And Purdue, as you know, is been in litigation, so that is a huge amount of money that has yet to be finally distributed. So any suggestions you have for that? Again, it's important for public health and prevention to be at the table in these discussions, but everyone's full-time job kind of precludes keeping up on this whole process. So our other towns have not been at the point to have consultants to help the work. So again, that program was, we made that toolkit to be a resource. And again, JSI has been contracted through the state to do the technical assistance. They come out to communities and talk. And some of our other towns will have the JSI staff who are doing now regular Zoom informational programs about strategies and spending and the reporting requirements. And also we were on a Zoom the other day, and the pot of 60%, the state has decided they'll be putting grant opportunities out for communities to apply for funding to spend out of that 60. So I'm sure Tim will be looking at that with Tiffany and identifying any opportunity. They just were awarded to a vendor to create the RFA. So it's a lot of money for a lot of years and a lot to sift through. So if you have any ideas for us how to make that easier for people, we just want people to be able to understand and be advocates for each of their towns on what the intentions are. Thank you.
I'm sorry. The funding that goes to the cities and towns, is that just distributed on a like per capita basis? Like how do they decide the 40%? How do they decide each town gets?
Tim may correct me, but I thought it was like population based. It was by the attorneys generals. So the state got, say, the 100, they have the 60, and then the 40% goes to municipalities. And I thought it was based somewhat on population because they don't base it on real data because they don't have the data for adults. Tim?
You didn't think so?
I don't think it's based on population.
Yeah,
I don't think I have not ever been able to find an answer to that question.
Oh,
So that's,
Interesting.
that's where I'm at this point. But I don't think it's based on population either, because it seems like some other populations that are close to ours are receiving less potentially.
Okay.
My other idea, it's based on programming or providers within the town, but I don't know.
Like
That's just-
already
that's my guess.
existing?
Like
Yeah,
impact.
Like, so they have
Yeah.
something to fund?
yeah, but that's just a guess.
Okay, because some of the towns that we work with, I mean, do we know how much they're receiving? And I mean, they may have, their gap may be that they don't have enough.
Yeah.
Exactly.
So we did the totals for our 4 core towns on the Mass Call 3 grant, but all the information is available on page 4. We listed where we got the totals from, but Carol and I did the math of adding them all together, so other towns would have to take a little bit of time to do that. And I think actually at the most recent webinar with JSI, they showed that they have a new tool on their website where you can kind of see a map and hover over the towns, and I think it will tell you the total they've received so far on there.
Yep. A big dashboard, data dashboard. Yep. But we can find out exactly how the main subdivision agreement and then the pot for municipalities is determined to answer the question accurately. And I apologize, I don't know that to say more than 80%. So.
Yeah, and I mean, I don't think we can be able to change the formula, but it may help us figure out, like looking at Dedham and Walpole and Westwood, they definitely got funded less than Needham did.
Yeah, and the state has said often that, they are welcome to pool and share their, whatever they're gonna fund with and share that resource. But again, shared service has been a hard thing to do, so many towns aren't taking up on that process just yet as well, so.
This is broken out by, I guess, defendant or whatever, Walmart, Kiva, Allen, et cetera, in terms of the amount from each one. I assume that that money from each one goes to the state, and then the state distributes it to the town of Needham. Just Needham gets one check, not a half a dozen checks.
No, we get a half a dozen checks.
You do?
Yeah, they're gonna do them in disbursements throughout the years.
Oh, really?
Yeah,
Cool.
yeah.
It's a very complicated
Yeah.
process.
Yeah.
Right,
Make me
because there are settlement dollars from different sources.
Funds.
Thank you.
Great, thank you.
Thank you both.
Okay, emergency management.
Yeah, Tyler's still sick.
So Tyler is sick. I believe I referenced it, I think I referenced it at the last meeting. Talib is covering right now, he's sick this week, for Michael, who departed for a job at the MBTA. The town has yet to post, but I think we will try to by next week, the full-time position. There's been a lot of feedback from residents of the town related to flooding. There's honestly a limited amount of things that public health or emergency management can do aside from providing information. But that's been sort of one of the common questions about flooding. At least in my opinion, we don't have the staffing to like distribute sandbags. DPW has some sand, but not necessarily enough to give it out to the public, and we don't have sandbags themselves. We don't have sump pumps, for example, either. I think it's challenging, especially when people are frustrated that their backyard and their basement are flooding. And the DPW director knows far more about it than I do, but I think at least for public health and emergency management, our role is to give out information in advance about the weather emergency and preparing yourself, and then to be available or ready if a significant chunk of the town loses power or a significant number of homes are uninhabitable, and then we could try to open up a shelter. I think the bar is a little bit high to open up a shelter because past practice has told us that not many people will come. They'll go to a neighbor's house or a friend's house or their tape house or something. Certainly that depends obviously on where the incident is and the circumstances of the people who it's impacting.
The question came up last night at Council on Aging in terms of, since the Center Heights is one of those shelters, how are the people in town in the affected areas notified that the shelter is there? How does that get out to them? Is there a robocall type thing?
We would potentially do a reverse 911. We would post on the town website. We would post on social media. I think that's a fair question though. If if you've lost power, you may or may not have any juice left in your phone, for example, to check. Yeah, that's a fair question. I think one of the challenges we run into is, if it was a very significant event, the best place to have a shelter is probably the high school, because you've got a large gym, you've got a cafeteria, and you've got showers and bathrooms. The senior center has a limited number of showers and bathrooms and a kitchen and a somewhat big space in the multi-purpose room, but not really any showers, just bathrooms. Rosemary has, during the summer, plenty of bathrooms and a big multi-purpose room with bathrooms with showers and a big multi-purpose room, but it doesn't have a kitchen really. And if it's during the winter time, there are no showers because the area downstairs isn't built for year-round use in terms of heating and insulation.
And backup generators?
So there is a portable generator at the Center of the Heights that's brought to the Center of the Heights for the winter season. There is a project, and I think it is scheduled for completion this calendar year, but don't quote me on that, that would install a permanent generator in the corner of the CAF parking lot and then tunnel under the parking lot the wires to the building, because right now the generator is parked very close to the building. It takes up two spots, and then you have the wires across the sidewalk, so it creates kind of a challenging walking situation for people. So that's a good thing. RRC does have a generator. I've tried, previous fire chief and I pushed very hard every time there was a building to say it needed to have an emergency generator. So town hall does, PSAB does, RRC does, CAF will, the library does not. But that's on the list eventually.
Kind of along the same lines, the town of Wellesley, their Board of Health is actually looking into collecting the names of people that have medical devices or are on medicines that require refrigeration, so medical devices that require electricity, and put them on some kind of priority list in case there's a power failure. And I'm bringing it up because it might be I don't know how it's going and how we would actually prioritize those people to actually get more power, other than to, maybe have some sort of portable generator sent to their house or something like that. But I just wanted to put it on the radar.
Yeah, I mean, it's an interesting idea, and we can certainly put it on our list to look into. I do think the town doesn't have aside from reports from residents, doesn't have an easy way to, like, it doesn't have a map that shows, this block is out and this block isn't. We do get reports from Eversource, and we do get reports from residents, so we can sort of try to backfill into a map, but it's only when we get those reports that we start to get an inkling of where in town doesn't have power. The fire department does maintain a list, but I believe it's voluntary for people to add to it for people who have medical devices that require power. I don't know about the refrigeration for medications, although that's a good point. We should think about that.
Wellesley has its own power company, right? So they know.
Right, and they hardly ever have power failures, actually.
Right.
From what I
I don't know
understand.
why, but yeah. Yeah, very interesting. Yeah, so they know every house, so.
Right, and then there it's a voluntary list as well. If you feel
Right.
like to
Yeah,
sign up.
like if you're on oxygen, whatever you.
That's not bad idea.
Okay, let's see, yeah, emergency management. I hope we get some good applicants. It's an important job. Substance use prevention.
Good morning, last but not least.
Yeah.
I think just in terms of adding to my updates from our December report, in terms of SPAN and our strategic plan, we're excited that we are moving forward with 2 new action teams for the coalition that at our December quarterly meeting drew some new membership and participation. So we're very excited, and of particular note, we're starting a new policy action team for the first time under my tenure. And we feel strongly that the coalition has matured to a place in the community where we're ready to take on the deeper acting work through policy change. So we have 2 members who have signed up to participate with us, and we're still excited about that. We're cautiously optimistic for beginning that, and policy work takes longer than some of the other efforts that we do regularly through SPAN, but I think that's a really good sign for the coalition to head towards this deeper acting environmental change in the community around substance use prevention. Another note, we've heard already how Angie McDonald started as of last week, January 2nd, in her 500-hour practicum as a peer recovery coach through our department. She's done a tremendous job coordinating her plans through Tiffany and I over the last several months. She's created a brochure, which I'll have available to share with you next month, as well as a business card. She has presentations scheduled, in fact, I believe she's scheduled to come here next month to do that presentation for you all. But we're very excited about the really sort of the newness to bringing peer recovery coach services to Needham. A free service, doesn't require people to have insurance. And with our community partners through the Center at the Heights, the social work staff there, as well as our law enforcement and the EMS services, we think that we'll be seeing some referrals coming through to Angie probably in the near future. Under our Stop Act grant, we worked with the police to conduct an alcohol compliance check last month. There were 29 businesses checked by 2 underage operatives, and there were 4 sales to minor violations, which is an increase from the previous compliance check, which was in September. There was 1. But then even earlier in 2023, in April, in that compliance check, I think there were 10. So it's been a bit of a up and down, if you will. Of the 4 that had sales to minor violations, there was 1 hotel and 3 off-premise businesses in that list. By and large, we've seen it to be a misreading of the operative's ID. They carry their own license, as you know. It's totally upfront in that regard. Julie's been very supportive to us in now trying to collect a lot of this data to show some trends over time, and we're hopeful in the coming months we're going to have a little more of that to show now that we've been doing these tips trainings and compliance checks since December of 2021 under the grant. And then lastly, last month, several of us helped out with the SBIRT training at the high school for 9th grade. Yes, 9th grade. Tiffany, Monica DeWinter, Angie McDonald, and I all attended the training to be able to assist with those screenings. You might be familiar, SBIRT is a state mandate that was implemented under Governor Baker a number of years ago. And it's a brief interview with 7th and 9th grade students about their substance use activity behaviors. So we were called upon by the health director at Needham Public Schools, Susanna Hunt, and we were able to help her with that.
Sorry, what is that? It's small group discussion?
It's one-on-one.
One-on-one?
Yes.
Wow. How many students did you have to?
So they did need a lot of our help because we went on specific days that we could make it. And so I think when I went for an hour, talked to 8 students. And then they were like, oh, you're good. We got a bunch of people. So they kind of do it as like, people are there. And then if there's someone in the hallway, it's like, oh, hey, you need to do your, so they don't have, they have a list. It's not accurate until the end.
But
So
I mean,
I only did
everybody
about
gets
8, but-
interviewed or sorry, how do they get selected?
They have to, I believe they have to interview a certain percentage
Yeah.
of the grade.
Okay, oh, I see,
Yeah.
so random
Yep.
selection, sort of,
Right,
and compliant.
yes.
Okay.
And we enter it into their database, their system there, and they use that to roll up for their reports.
Interesting, sorry.
I found it an interesting process. It was the first time I had done any of those screenings, so
Mhm, mhm.
it's a bit of an eye opener.
Yeah.
Speaking of high school students, I'm part of a 5-person team, just a little preview, who will be conducting teen mental health first aid for the first time for the 10th grade students at Needham High, starting later this month. And we're doing that through the wellness classes. The director of wellness for the Needham Public Schools has basically partnered with us to say, we're going to turn over our wellness class curriculum hours for the 10th graders for the teen mental health first aid. It's a 6 45-minute program for them.
So you're instructing them.
We are, we're gonna be up front, right in front of the classroom, the videos and engagement and all of that, but it's
And that's,
It's a pretty big, undertaking.
Yeah.
and that's something that students choose to do, or it's a requirement of,
Well, in
All
this
of them?
case, it will be part of their wellness classes.
okay,
So we have
so,
really a
lot of
captured audience, if you will.
yeah, no, that's great.
They don't have to volunteer.
No, and the emphasis here, just to remind folks on this, is not to teach them about all of the mental health challenges that exist out there. It's mostly helping them to respond to a peer who may be showing signs of a mental health condition, and in some cases, there may be more of a critical condition, and then helping empower them to connect that peer to a trusted adult. So.
I got an email yesterday from the school as a parent of a 10th grader that explained the whole curriculum and everything. So it looks really great. I think if somebody wanted to opt out, they probably could, but anyway, it was a very good email because it really outlined all the 6 sessions and what's going to be covered, et cetera.
Look forward to your anecdotal feedback.
Yeah.
If I might just circle back to, was able to find on Mass DPH website, how they calculate the opioid funds. I'm gonna try to say it
By
succinctly.
committee.
It's based on, from lawyers and experts who are on the National Opioid Litigation Model Development Plan. So they allocate based off US Department of Health and Human Services prevalence of opioid disorder from 2007 to 2016. That's 1. 2, from Center for Disease Control, overdose deaths from 2006 to 2016. 3, from the DEA on opioid shipments from the years 2016 to 2014 to the county. And then they split it up, the state splits it up based on municipalities how they have historically split funding on government functions relevant to opioid, including education, public welfare services, and healthcare.
So it's also,
Okay.
if you have more resources, you get more
Yes,
resources.
which is a weird way to make that work.
But in a way, it is like people have already, they have systems in place, but
Yeah.
it's interesting.
Yeah.
Complicated.
Yeah. By committee, sounds like.
Karen, can I just ask a question about the compliance checks? You said it was, most of the cases were misreads, and that was by the salesperson or by the scanner?
Largely by the salesperson, the server, well, in this case, the cashiers.
And
There was one use of the scanner, however, that proved to be a problem. They put the operative's ID in the scanner, which is, to my understanding, intended to prove whether or not the ID is valid. So the scanner showed a green light that said passed or whatever. And the clerk, the cashier, interpreted that to mean that the individual was of age to purchase. So I think there was a potentially education issue around the interpretation of those results from the scanner.
It seems like the scanner should check age too. I mean, it's so weird because the tobacco.
Yeah, I
one
thought that's what the
does.
scanner did. Yeah, I thought the
Yes.
scanner looked at age.
Really, I'm not.
Or it's a
I'm not,
setting or something.
Entirely familiar with the various scanners. I think that the establishments have the opportunity to choose a scanner. I don't think there's one standardized, so I'm not that well acquainted with all of them. But but at the end of the day, they interpreted that green light through the scanner to mean that the individual was of age, and they were not.
it was just saying it was a valid ID. It was just
It
saying
was
it's
a
a
valid
legitimate
ID.
ID. Got it.
Right, because our operatives use their own IDs.
Right.
So that was unfortunate.
Yeah.
Yeah, I mean, the whole point of the scanner was to hopefully say they're underage. So that seems odd, but and then the others not using the scanner, is that, I thought that was kind of now it's a,
Well,
I don't know if it's a requirement or a recommendation to be using those scanners.
so that's an interesting point, Tejal. I did speak with the town manager's office about that requirement, because they have put in the regulations that all businesses have, all licensees have a scanner on the premises. And the communication I received back from the town manager's office is that the scanner is intended more as a secondary or backup to the cashier or the server doing a physical inspection of the ID. So if they needed support or backup to use the scanner, but the interpretation I got was that visual inspection by the employee is the primary means for determining the age eligibility to purchase. So.
Okay, that seems a bit backwards, because we know to err is human, humans will make mistakes, which we're finding clearly. So anyway, I think I usually get invited to the select board meetings with the folks that don't pass, but I've missed the last one in December because I was not here. I don't know if I'll get invited to the next one, but I just wonder if we should have a discussion around that, because I mean, that, first of all, understanding what the scanner shows, because if it's only showing valid ID and not checking age, that's kind of defeating the purpose. And then second, you know, really the scanner should be primary, because relying on human beings, they're going to make mistakes looking at these things. So anyway, we can talk about it.
Yeah, I guess the scanner's only getting the fake ID.
Right.
So it would never work for our issue because we always provide a valid ID. It's just, it's just.
I mean, bear in mind that the TIPS training that we conduct multiple times throughout the year is strongly focused on helping educate the servers, the employees, how to read an ID properly. That's
Yeah.
a huge part.
And don't we give the tear off calendars too?
And we provide
I
free
mean,
of charge. For the last 3 years, through our grant, we have purchased the daily week card calendar that you tear off every day, and it shows you the date by which you judge if someone's 21.
Yeah.
We just delivered those.
That's, to me, that's a great thing. It's right there. You don't get confused. Anyway, okay. Well, interesting. Oh, look at that. Kind of early.
Shortest meeting ever.
Anything?
So at the back of the packet for the board, there is an updated staff list. I did want to mention, and I'll forward it to the board. All sort of boards and town committees are invited to a community workshop on January 18th about multi-family zoning. It's in Powers Hall from 7 to 9, and it's also on Zoom. But I will forward the invitation to that for the board.
I'll just raise just the quiet, the train whistle thing. I've done some work on airport noise that, you know, you definitely see cardiovascular effects. You see cardiovascular effects while people are still sleeping. So they do heart rate monitors. This is more at Heathrow. And at Logan, you know, they do the sound, you know, sort of contours around the airport. Anybody above 70 decibels gets their house insulated and windows redone. So I mean, noise is a real. And having been woken up this morning by the train, I mean, it is a lot of train whistles very early to late at night. I won't be here to address it, but I don't know what the interventions require. I'm sure it's all money and expensive, but I'll advocate for looking at the, at least talking about it.
Yeah.
I'm about to change my tune on that. I was where I live, I can just hear them in the distance. And I've grown up ever since I was a little kid with train whistles in the background. So I kind of like it. But one of my friends just moved into the building on Oak Street that they just built right next to the tracks.
Yeah.
And his apartment is on the railroad track side. And he gets blasted out constantly all day long as they blow the whistle at crossing.
And it's variable amongst the train engineers too, because I also hear the train where I live, and some of them could do a little quiet toot toot when it's 5 o'clock in the morning, and others like lay on the full 15 seconds, 4 blasts at every single stop.
They follow the rule.
You know, I mean, I know it's been a concern of the community for a while, so I think it'd be great to put it on this agenda item. And also, if we could if we could get some data on the health impacts of the train business. And I think it's out there. I haven't looked myself, but it would be just helpful to have.
Yeah.
Okay.
And if
That's
not.
And the
Yeah.
safety impacts of, what are the safety impacts of the quiet zones too, in terms of accidents or things like that, just knowing a little more about.
Right.
Health.
Right,
and
no,
safety pieces.
And I think that data is out there too, that if you just stop doing the whistles, accidents do go up. So it's a public health balance, but I think there's ways to do it safely and get both that's safety and reducing the health impacts.
But I remember living in the Midwest and the train came through town and it tried to blew the whistle at the beginning of town, all the way through town.
Yeah.
And they roared through the town. They didn't
Right.
slow down for anything.
Yeah, I was just in Sioux Falls, I experienced that, it was amazing. So people do live with it in places, but,
I mean, in my psychology class in college, they said, oh, well, when you move next to the tracks, like it wakes you up the first month and then you just sleep through it.
Yeah.
You get
Not-
used
not
to it.
once you
Your
have
brain gets
kids.
used to it and sleep. And as students, we're like, oh, that's really interesting.
Yeah, yeah.
But I don't think that's the case.
yeah, and I think it's also a little more low level, like,
So
continuous exposure.
my previous condo was as close as you can possibly be in Rosendale.
Yeah.
And it was just outside the station, so you'd hear the toot toot as they get ready to leave.
Mm,
And I definitely got used to sleeping through it.
Yeah,
I do think it's different when it's the at-grade crossings, because it is longer and louder.
Yeah.
Rather than just the clang, 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 toot toot when leaving the station.
yeah.
And there's variation among the operators of the train.
Oh, yeah.
Mm.
And as Rob said, there's some days, they just lay on that work.
If I have to be awake.
Sunday morning at 5 o'clock, whichever engineer that is,
Yeah.
it's always the
And
same
they're empty
person, I think.
trains, sorry, on Sunday morning and Saturday morning, unfortunately. Yeah, anyway, it's my 2 cents. So I think we're just about wrapped up. I'll say, I'm really sorry to leave quickly like this. I did reach out to each of the board members, and I have really loved working on doing all this work for the town. It's a town I love, but I am in fact leaving and moving out of town. And so thanks for all the hard work, everyone. I mean, in all the different ways, public health, people just don't understand, the breadth and depth, how closely we have to get involved. So, but thanks for all your hard work, and it's been fun working with you
Well,
guys.
Kathleen, it's been great working with you. And I think all of us appreciate your expertise in the areas that you have been able to provide us with information. You came on the board just at a time when there was a lot of things going on in town,
Yeah.
about microwave towers and electromagnetic radiation from burying wires under the street and everything else. And we didn't have the expertise, and we were able to give it to us.
Here and there, I think.
And we hope that you will continue.
Yeah, I'm still
to
on your
maybe
short
do
list,
that
so
on-
feel free to call and.
On a curbside basis.
Field,
And thank you for your service.
Yeah,
We
thanks.
we really, I really enjoyed working with you.
Yeah.
And appreciate you being on board.
Yeah, thank you.
Pleasure.
Thanks, Kathleen. I really appreciate it. You helped kind of orient me to the board, and I appreciate the time you spent with me as well. And you've been just a great colleague, so thank you.
Thank you. Thanks for being chair and whoever gets to be chair next year. Enjoy that. So anyway, all right. I'll get a motion to adjourn.
So moved.
Second.
Okay, all those in favor, Tejal?
Yes.
Yes. Rob?
Yes.
Ed?
And yes.
And Kathleen, yes. All right.
Meeting
Thanks.
adjourned.
Go in
Thank you,
peace.
Kathleen.
15 minutes early.